The measles outbreak continues to grow, and it's changing the way hospitals care for patients. Fox 43's Macy Markham spoke with a pediatric infectious disease specialist who says the resurgence of a disease many considered a thing of the past is forcing healthcare providers to adapt quickly.
For years, measles was something many doctors only studied in medical school. Now, it's something they're seeing in their hospitals.
I think most doctors and nurses learned about measles as a disease of history. So we sort of are generally aware of it. But now we're having to really figure out how that plays out practically.
That shift has been swift, and for Dr. Erickson, that change is reflected in her own experience.
I had never myself taken care of a child with measles until about 2 months ago. And now we've had a handful of children who've been sick enough from measles that they've actually been admitted to the children's hospital.
The challenge isn't just treating the virus, it's recognizing it from the start.
It's a respiratory virus that eventually gives you a rash, but in the first several days of illness, it looks just like any other respiratory virus: cough, fever, runny nose, those kinds of symptoms.
Patients who may have been routinely treated just a few years ago have to be screened differently, and in some cases, isolated immediately to protect other patients and healthcare workers.
So in the hospital, we're having to think about measles sort of right away to keep our other patients and our staff as safe as we can.
And because so few providers have actually encountered and cared for measles patients, they're also learning what the disease can look like.
For the doctors and nurses taking care of these patients, it will have some learning to do because we aren't familiar with what those other things that measles can do are as we are with other illnesses.
Dr. Erickson says that experience will come with time, but she hopes it doesn't have to. As cases continue to rise, experts say the best way to prevent contracting and spreading the measles is to get the measles, mumps, and rubella vaccine. Macy Markham, Fox 43 News.